Hello, welcome to Smile with Pediatrics. Today's topic is the loops in sepsis. The molecular events in sepsis involve a range of cellular structures, spanning from minute structures like platelets to complex organ systems, and some of these may be unrecognized in clinical practice. Platelets are small but mighty actors in sepsis and are activated at sites of infection and tissue injury. Activated platelets exert complex control of the stages of inflammation, contributing to pathogen clearance, wound repair, and tissue regeneration. Indeed, thrombocytopenia has been associated with poor prognosis in sepsis. On the other hand, inappropriate accumulation and activity of platelets are implicated in the development of organ failure, including acute lung injury and acute kidney injury, as they catalyze the development of hyperinflammation. Platelets are also implicated in disseminated intravascular coagulopathy. Thus, the right degree of platelet activity is vital to achieving a healthy response to infections. In the context of the clinical picture of the index child, the platelet count, mean platelet volume, and platelet distribution width can be helpful in guiding treatment choices. Another important contributor to the sepsis loop is the autonomic nervous system. Also largely unrecognized, the failure of the homeostatic balance between the sympathetic and parasympathetic branches orchestrates a cascade of events that promote sepsis. The autonomic nervous system dysfunction is often due to excessive stimulation of the sympathetic branch and inadequate counter-regulation by the parasympathetic branch. The roles of the autonomic nervous system in sepsis include the regulation of inflammation and immune modulation, temperature control, as well as the regulation of other organ systems of the body. Whereas humoral and cellular immune responses may take several hours to days, the immune-mediated response of the autonomic nervous system can occur instantly. In addition, the cholinergic anti-inflammatory pathway is considered crucial in the pathophysiology of sepsis. In clinical practice, achieving the right balance between both branches of the autonomic nervous system is crucial for each index patient and informs the use of catecholamines and anticholinesterase in sepsis. Yet another major contributor to the intricate loops of sepsis is the bone marrow, which is responsible for the production of circulating blood cells and also has immunoregulatory functions. Sepsis disrupts these functions and causes bone marrow depression, which may persist even after recovery. Bone marrow recovery can be achieved by treating the acute infection, as well as the right nutrition, exercise, and sunlight. This requires clinical experience and may involve other medical disciplines as well. In addition to all these, the presence of microbial components, inflammatory mediators, tissue ischemia, lactic acidosis, mitochondrial dysfunction, and endocrine factors, etc., in the internal milieu all at the same time further complicates the intricate loops of sepsis. One thing leads to another, and the resultant effect will be an exponential disarray of the internal milieu, which may cause death. In a particular patient, each component contributes to the entire disease syndrome to a different degree than in the other patient, and in the same patient, the dynamics also differ from time to time. This means that the treatment of sepsis should be individualized and dynamic, tailored to the index child at the index time. Again, the right nutrition for each patient is of paramount importance in sepsis and should aim at strengthening the immune system and curtailing inflammation. Vitamins have demonstrated useful effects in this regard. As a simple guide, early enteral nutrition promotes homeostasis and recovery and should be encouraged whenever there are no contraindications to enteral feeding. In summary, with sepsis, no two patients are identical, and so their treatment should be personalized. Thank you for joining us on Smile with Pediatrics. You can please follow us on the link below.